Hi, my name is Yuki Dava, and I did my project on the relationship between vitamin D levels and brain volume in children with demyelinating diseases of the central nervous system. One of the diseases I decided to focus on was multiple sclerosis, which is an autoimmune disease that targets the central nervous system, specifically the myelin. Another is MOG antibody disease. Antibodies are responsible for the destruction of the MOG protein, which is coated on the myelin sheath. Although MS and MOG disease may sound similar to one another, they are two separate demyelinating diseases. Evidence has shown that higher vitamin D levels have been associated with less autoimmune responses in adults with multiple sclerosis. However, the relationship between higher vitamin D levels to higher brain volume has never been investigated before in pediatric demyelinating diseases. So the purpose of this study was to determine if higher vitamin D levels are correlated with a higher brain volume in 3 pediatric demyelinating diseases. 59 patients were recruited from the Canadian Pediatric Demyelinating Disease Study, of which 12 were diagnosed with multiple sclerosis, 21 with MOG disease, and 26 with monophasic or one-time demyelination event. Results showed that out of the 3 groups, pediatric MS had the lowest median vitamin D levels, giving more evidence that insufficient to lower vitamin D levels are a specific characteristic to pediatric multiple sclerosis compared to other similar demyelinating diseases. When comparing brain volume among the 3 groups at onset of the disease and the 1-year follow-up, there was no significant correlation among the two. And finally, when running 6 linear regression tests, it was found that there was no significant correlation between higher vitamin D levels to higher brain volume, although weak but positive trend lines were observed. In the following days, more patients and follow-ups can give us a more comprehensive view on the relationship between vitamin D levels and brain volume. And even further, investigating lesion volume to vitamin D levels can give us a more comprehensive view on a specific patient's disease course. Thank you so much, and hopefully we'll find a cure to pediatric demyelinating diseases.